I've sort of saved the best for last of our interviews here at the 4th Annual National Cannabis Therapeutic Conference. Dr. David Bearman, he was the person behind having the conference out here in Santa Barbara. How did it come to pass that they held the conference here in Santa Barbara?
Well, the short story is that they felt that this was the time to have it in California. We're one of the 11, 12 states, the number keeps getting larger, that people can get medicinal cannabis. There's got to be a lot of patients here. There has to be a lot of doctors here. And they figured that they could get good attendance and that they might be able to get some good national attention here. So they were going to have it in California, and there was some thought as to whether to have it in San Francisco or Los Angeles. And I think that part of the fact is that I presented at 2 of their previous conferences, and we developed a nice friendship and relationship. And also, I told them that I thought that Santa Barbara was pretty receptive to medicinal cannabis, and we certainly saw that here at the conference as we were greeted by the mayor this morning. We had a short talk by the 2-term former mayor. Both of these politicians are extremely popular, and I think they reflect the attitude of the vast majority of citizens here in the city of Santa Barbara.
In a way, I think they reflect the attitude of the vast majority of citizens, period, on the issue of medicinal marijuana.
Well, that certainly could be the case, but in some places you have people who aren't really fully using their judgment, and rather than listening to physicians and scientists about medical issues, they're paying too much attention to fear-mongers.
And of course, that's what this whole conference was about, is about answering the fear-mongers and getting the information out. What were the organizers of the conference, who's the patients out of time, were they happy with how things went here?
I think so. They had great big smiles on their face. I'll have a chance later on today to talk to Mary Lynn Mathra, who's a RN, and her husband, that's great. I have Al Byrne, who's a retired lieutenant commander from the Navy. But I think they're quite happy. And we met the number of patients and the number of attendees that we thought that we would have. We had a fairly large number of health professionals that showed up. And we got good coverage in the paper and on TV. So I think that they're quite happy with the participation, and certainly I'm happy with the quality of the presentations that we got. I mean, I thought they were outstanding. I think that there was a good deal of information that was transmitted, and as usual, you had this unique interaction between researchers and clinicians and patient caregivers.
And what was your favorite part of the conference, if you had to pick one out?
Well, I tell you, when you're running these conferences, it's really hectic. It's hard to say. I had encouraged Joan Dangerfield to participate in the conference, and the fact that she was able to pick up when we had the machines winning on our technical glitch, when we couldn't show the video of Rodney Dangerfield on his last appearance on the Leno show. And she had told me that she was quite nervous, and she picked up and didn't miss a beat and did an excellent job, I think, of conveying to the people here why Rodney used cannabis and why it was helpful for him. Did you happen to be there when she was speaking?
Oh yeah, it was one of the most poignant sections of the whole conference, the way she talked about her husband and his use of and how it improved his life and stuff.
Yeah, I think that to me, listening to some of these patients, it's incredible, and I was very pleased that we had Dr. B.J. Miller here, who's a triple amputee. I mean, he just comes across so matter-of-fact and so normal, and yet there he is, obviously suffering from phantom pain syndrome and not being particularly bothered by it, largely as a result of the analgesic effects of cannabis. And I was also really pleased with with Rita Salinas, who is a local community activist and a woman who has pretty significant arthritis, and she's a woman in her mid-70s, and she said, gee, I wonder how my neighbors are going to feel about this. And she's really willing to get out there and speak out, and I told Rita, I said, your neighbors voted for this 70% to 30%, and maybe your neighbors voted for it even more. And she just felt that it was important. I'm not sure that I can put my finger on any one thing, but the reaction of the people here that this was fantastic, that they got a lot out of it, that they were happy that we brought it to Southern California. Being able to bask in that kind of positive feedback is probably the best thing for me.
Well, you've done so much for the movement, and bringing this conference here was like a crowning achievement. So what's life going to be like for you post-conference?
Boy, I don't know. I think I'm going to spend a little bit more time with my wife and my children. And I came out with a preview, abridged edition of the book that I've been working on for quite a while, and I expect that I'll be working on that to hopefully get it out sometime in September. And the other thing is that one of my goals with this was to put myself out of business, to have a ripple effect so that we would have more and more of the primary care physicians in the South Coast here feel comfortable with both the law and the science so that they would make recommendations to their regular patients for the medicinal use of cannabis and decrease the number of patients that I'd have to see because they were worried that their doctor wouldn't make the recommendation or might frown upon their medicinal use of cannabis. So I'm kind of looking for a little bit more relaxation, if you don't mind.
Well, from the list of doctors that were here, I think that might actually come true. Doctor, thank you so much for everything you've done for the last umpteen years on this, and thank you so much for having this conference here. It was marvelous.
Lanny, I'm going to let you have the last word, but I just want to compliment you on the amazing work that you have done. I mean, there are only 3 counties in Southern California that have the state medicinal cannabis card, and one of them is Riverside County. And I think that if you would ask somebody in a quiz show to name the 3 Southern California counties that had voluntary medical marijuana patient ID cards, you wouldn't get 1 in 100 that would say that Riverside would guess that they would be one of them. And I congratulate you.
Well, that's the last word as far as I'm concerned. Thank you very much, Doctor.